Hello everyone, I'm Simran and thank you for tuning in. This is Pink October and we will be talking to you about breast cancer and how to deal with it. Now, fortunately for us, we have Dr. Emily Mah, Consultant Radiologist. Dr. Emily is a graduate from Jawaharlal Nehru um, University, India. She is she completed her master's degree in UM, and she's also a member of Royal College of Radiologists. Now, let's welcome Dr. Emily. But before that, a quick update. If you have any questions, do write to us and drop it in the comment box below. Dr. Emily, how are we today?
I'm good. You're looking great.
Thank you.
And thanks for the kind introduction.
Yes, thank you, Dr. Emily. Now, tell us, how common is this breast cancer and how do we deal with it? There are two types of mammogram, 2Ds and 3Ds. I'm sure that viewers would love to hear it from you. All right, welcome back, everyone. We apologize for the technical error. Let's start. Let's begin, Dr. Emily.
Yeah. So the Malaysian National Cancer Registry report in 2007 to 2011 stated that breast cancer accounted for 32% of all female cancers. So this pie chart is showing the number of new cancer cases in 2018 of all females of all ages. So as we can see here, breast cancer accounted for 32%, which is about one third of all cancers in women.
Right.
Yeah, it is actually the most common cancer for us. Next is colorectal cancer, and the third most common cancer is cervical cancer. So they actually say that 1 in 19 women in Malaysia is at risk of developing breast cancer.
That's quite high, Dr. Emily.
Yeah, that's right. So when we say early detection saves lives, we need to know what are the stages of breast cancer. There are basically 4 stages of breast cancer. Of course, some people also say there's a stage 0, but we will just take these 4 stages first.
Right.
Yeah. In stage 1, the size of the tumor is 2 centimeters or smaller and has not spread outside the breast. And the survival rate, 5-year survival rate for stage 1 breast cancer is 99%, which is like almost 100%. In stage 2, the cancer has reached the lymph nodes. Regardless of the tumor size, the 5-year survival rate is about 86%, which is quite pretty good. Yeah. So in stage 3, the cancer has spread to nearby tissue outside the breast, such as the chest wall, and 5-year survival rate drops to 57%, about half. The cancer has metastasized in stage 4, spreading to distant parts of the body. 5-year survival rate is only about 20%. So when we say early, we mean stage 1 and 2.
Yes.
So the survival rate is better when the cancer is found in stage 1 and 2.
Right.
So we have another table here which shows a relative survival rate by year and selected variables. The variables are the age groups, the ethnic groups, and the stage at diagnosis. This was taken in the period of diagnosis to 2007-2011, and cases were followed up to 2016. Yeah, so you can see in this, in terms of age groups, survival rate, 5-year survival rate is about the same, but slightly better in older age group. I think this is because in younger patients, the cancer is a bit more aggressive. Yeah, that's why they relatively less, but it's still about the same.
Yes.
In major ethnic groups, Malay is the most affected at 7,568 cases in that period, and its 5-year survival rate is only 57.9%. I think this is because our Malay community is generally conservative. Yeah.
Yes.
So when they come, the tumor is already in later stages.
Sad, but that's the true fact. Yes.
So the stage of diagnosis at stage 1, 5-year survival rate is 87.5%. In stage 2, about 80.7%. But in stage 4 cancers, survival rate is only 23.3%.
So, Dr. Emily, can I just ask you, earlier you were saying the survival rate is about 99%, but here it shows 80.
That's very good observation,
Yes.
Simran. Yeah, in stage 1 cancer, we are supposed to get
Mm.
99% to 100% cure rate. But in our country, it's only about 87.5%. So I think it is very sad to say that in our country and probably in some other Asian countries, there's still a lot of stigma around cancer. Yeah, so these patients, when they are diagnosed, they will generally don't take it. They take it very lightly, or they ignore.
Yes.
Yeah, they are scared of the security of their jobs.
Yeah.
They are scared of how they are being treated in the community. Yeah. Some patients are taking treatment into their own hands.
Yeah.
So
On traditional.
And some of them even totally ignore treatment.
Yeah.
You know,
I also heard they just pray for it to go. There are cases
so,
like that. Yeah.
So let's go on. So there's still a lot of education, awareness.
Yeah,
in
awareness
our
is
part of the
important.
world.
Looks like it. Yeah. Yes.
So with average survival rate of 68.8%, where do we stand in the world? So comparing with other countries, we are only slightly better than Thailand and India. And we still have a long way to go.
That's really disturbing. If you ask. Yes.
So prevention is better than cure, they say. Yeah. Can we actually prevent breast cancer? Yeah. Before that, then we need to see some of the factors that contribute to breast cancer. Yeah. One is getting older. The risk for breast cancer increases with age. Most cancers are diagnosed after age 50. Genetic mutations such as BRCA1, BRCA2. Women who have these genetic changes are at higher risk of breast and ovarian cancer. Reproductive history, early menstrual periods before the age of 12, and starting menopause after age 55 expose women to hormones longer, raising their risk of getting breast cancer. Women having dense breasts are also more likely to get breast cancer. And personal history of breast cancer or other certain non-cancerous breast diseases also predispose women to get breast cancer a second time. Yeah, family history of breast or ovarian cancer, previous treatment using radiation therapy, particularly to the chest or breast, like previously in the treatment of Hodgkin's lymphoma. Yeah, but nowadays we are not treating Hodgkin's lymphoma with radiation anymore. These are, as you can see, these are the major risk factors, and many of them we have really no control of.
Right. Yeah. Yes.
But there are some risk factors that we can change, like not being physically active. They get higher risk of getting breast cancer, overweight or obese after menopause, taking hormones like in HRT, hormone replacement therapy, taken during menopause, certain oral contraceptive pills, reproductive history also, like having first pregnancy after the age of 30, not breastfeeding, and never having a full-term pregnancy can increase the breast cancer risk. Drinking alcohol is a significant factor as well.
Social, huh?
Yes. There are also other emerging risks. These are not for breast cancer alone. These are also for other forms of cancers. Yeah, like low of vitamin D levels, light exposure at night. The results of several studies suggest that women who work at night, like factory workers, doctors, nurses, police officers, for example, they have higher risk of breast cancer compared to women who work during daytime. DAS is used in previously for miscarriage. I don't think anyone is exposed to this now, but this is because it was found to have increased risk of breast cancer. And eating unhealthy food, exposure to chemicals in cosmetics, sunscreen, the food we take, water we drink, insecticides, pesticides, exposure to chemicals in plastic. The list is just
It
endless.
goes on and on. So, shall we
Yes.
stop gardening?
So we say lung cancer is preventable in 90% of the cases, but breast cancer in actual fact only in 10%. This is because non-modifiable risk factors like getting older, being a woman, having breasts, having the genes, they are really out of our control. So the key here is early detection.
Yes.
We must detect the cancer when it is in our body.
Yes.
So that the treatment outcome would be better. So as early detection of breast cancer saves lives. This is especially important with breast cancer because unlike some other forms of cancer, patients have a survival rate of 99% if the cancer is discovered in its early stages. The prognosis is better, treatment success rate also will be better. So with that, we see some of the breast cancer symptoms. These vary from person to person. Some are common. Early warning signs of breast cancer include lumps or knots felt on or inside of the breast, change in the nipple color, swelling, redness, or other visible differences in one or both breasts, an increase in size or change in the shape of the breast, changes in the appearance of the nipple discharge other than breast milk, usually bloody nipple discharge, yes. And pain, although less common, but it is one of the symptoms.
So you don't feel the pain at all?
Usually they present as lumps. So let's see some of the tests that can help diagnose breast cancer. There are many actually, so I put 4 here, but we will mainly talk about mammogram and ultrasound. There are others like MRI, other breast tissue biopsy. So here I would like to stress the importance of breast self-examination as well.
That's very important, self-examination.
There are some studies that say breast self-examination has no contribution to breast cancer detection, but we see in our daily practice, there are patients who come to us with self-detected cancer.
Right.
So I personally believe that you should be the one who should know your body best.
Yes. See, you heard that, audience? You have to recognize your body first before coming to the doctor. But early detection is still on top of the list.
So let's talk about mammography. Mammogram is actually simply X-ray picture of the breast. Some early breast cancers only show up as microcalcifications on mammography, which are not even visible on ultrasound. So 80 to 90% of early breast cancer is diagnosed on mammography alone on the basis of microcalcifications. So very, very few cases present as a palpable lump. This is the most widely adopted method for screening of breast cancer. This is a mammo machine. Our mammo machine is this in Assunta Hospital.
Pretty looking, yes.
And this is our mammo machine in X-ray department, Assunta. So the radiographer positions one breast at a time between 2 plates on the machine here, and you will feel a little pressure, and it is likely to be uncomfortable, but some women find it painful, but it will be over very quickly. You have 2 X-rays of each breast, one from the top and then one from the side.
So it's a compression, really important.
Yeah. So these are some of the pictures of mammogram. Yeah, these two pictures are normal mammograms. This is the top view, and this is the side to side view. These two are normal mammograms, and you will see in this picture abnormal mammogram with a lump here.
It's very clear.
So, although we say mammography is the best tool to detect early breast cancers, but we still miss 15 to 20% of the breast cancers. The sensitivity decreases significantly with increased breast density. Yeah, the more dense breast you have, the more difficult it is to see a cancer in a mammogram. Approximately 10% will be recalled for further workup, and 75 to 80% of breast biopsies will result in benign results. So now we have something called a 3D mammography, which is a digital breast tomosynthesis, the other name. Yeah. It is an advanced form of breast imaging or mammography that uses low-dose X-ray system and computer reconstruction. Yeah, so, and it was first approved by FDA in 2011 as a technique for breast imaging. So as this technique is becoming more and more common, it's slowly replacing our 2D mammogram.
So we have this in our hospital.
Yes, we do have
Yes.
digital
3D.
breast tomosynthesis in Assunta. So let's see what is a 3D mammogram. Yeah, so in a 2D digital mammography, so the breast is placed on the plate, compressed between two plates. The X-ray tube is actually stationary and shoot, we get one image. Yeah. For tomosynthesis, the breast is compressed as for a regular 2D mammogram, but the X-ray tube moves in and up over the breast. So in this manner, we will create multiple images, and the computer will reconstruct the images into 1 millimeter thickness. And so it's like onion peel. We'll be studying the
Layer
breast
by layer.
layer by layer.
Compared to
Yeah, we
one
only
sheet.
have one image for
Yes.
this 2D mammogram, but many images of the breast in a 3D mammogram. So let's further illustrate this, the differences between 2D and a 3D mammogram. So, so in this illustration, we can see the breast is compressed between two plates. So in the breast, there are many structures, fibroglandular breast tissue, and this one is a lesion. We say this is breast cancer. Yeah, so when we take a 2D mammogram, only one image will be formed, and everything inside the breast is overlapping. So the breast cancer within the breast tissue may be obscured in some instances, especially if you have dense breasts.
Right.
Yeah. So the cancer might be obscured, partially obscured, and this may be interpreted as normal. So in a 3D mammography, as I have explained, we will have multiple images layer by layer. We will be studying the breast layer by layer. So in one of the slides, we will see these two structures as two separate structures. So we will be able to see the cancer as a separate structure, and this, we will call this cancer. So in this way, detection rate for 3D mammogram is better.
Of course, more advanced.
So these are the real life images of a 3D mammogram and a 2D mammogram. So as you can see, in 2D mammogram, we have a lot of structures here. All these lines, fibroglandular breast tissue, and actually there is a cancer here. Yeah, but if we don't know there's a cancer here, we will interpret this as a normal mammogram.
Right.
So the same patient will do a 3D mammogram. So in one of the images, we will see this abnormal, irregular structure.
So much different. Yes, so much different. Yes.
So the fibroglandular breast tissue is we don't see so much of those.
Correct.
Yeah. So let's see. So in this illustration, again the breast is pressed between two plates. 2D mammogram, we will have one image, and there is actually nothing in, no cancer in this breast.
Mhm.
These are all fibroglandular breast tissues. So, but because the breast is very dense, a lot of tissues overlapping each other, we will see something we're not sure, it could be cancer, could be not. Yeah? But in 3D mammogram, we will take pictures layer by layer. So the asymmetry will be resolved. We will see it as this fibroglandular tissue, this is another piece of normal tissue, another piece of normal tissue. So we will interpret the mammogram as normal. But on the 2D mammogram, we may say there's something abnormal, speculated something suspicious. We may call the patient, we may do breast biopsy,
Oh,
it turns out to be normal.
correct.
Yeah.
So it does allow the radiologist to see more images.
Yeah, clearly, and our diagnosis will be more
Better than
correct,
yes,
and then be
accurate.
yeah, more accurate, and you have more confidence to say that this is normal.
Confidence.
There's
Yeah,
nothing that
correct.
no need biopsy.
Thank God for that.
So people often express concerns about mammograms because they expose you to radiation. Given that you may be screened annually, you might even have fears that the cumulative radiation may one day cause cancer. So that is rarely the case. Ultimately, the level of radiation exposure in a mammogram is extremely low. It is about the same as used in a dental X-ray and less than what we use for chest X-ray. So scientific data has shown that doses 100 to 1,000 times greater dose than those required for than those used for mammography are required to show any statistical increase in breast cancer. Yeah, so that means you do 1,000 times mammogram, maybe you will get breast cancer, but not once in a while, once a year or twice a year.
Yes.
So for its part, the National Cancer Institute insists that the benefits of mammography outweigh the potential harm from radiation exposure.
Right. So people are also worried about radiation, and so how bad it is compared to, you know.
So sometimes we explain radiation in terms of background radiation. So it is actually only about 2 months background radiation.
Background radiation.
Yeah.
Okay.
Some people also expressed it as background radiation in the air. So it's actually about one transatlantic flight. That is from probably from Europe to London, from Europe to US. Then that one flight
Equivalent to this.
mammogram. So it's actually very low. So when we say about screening, sometimes we hear about screening mammography. Yeah, what is screening? Yeah, breast cancer screening means checking a woman's breast for cancer before there are signs or symptoms of the disease. That means before you feel any lump, before even you feel any pain,
Yes.
you go for a mammogram. That is screening. So if you have a lump already and you feel pain, you just want to know what's the cause of the pain or the lump, that's diagnostic mammogram. It's no more screening mammogram.
Yes.
Yeah. So women aged 40 and above should get mammograms every 1 to 2 years annually if you have very high risk factors.
Right. Family background.
Yes.
We do get people who come to us and say, I'm 35 and I want to do mammogram. So we tell them, sorry, you need to wait until you're 40.
Actually, we can start with ultrasound first.
Ultrasound.
If you are 35 to 40, we can consider mammogram if you have high risk. But you must see a doctor and
Get
get
consent?
get his recommendation. If you really have high risk factors, we can start your mammogram at 35.
Right.
The next investigation, very common investigation that we do is ultrasound.
So this is what we have here. Yes.
The ultrasound uses high frequency sound waves to produce detailed images of the inside of the breast. It is a safe procedure. No radiation is involved. widely available, easy to use, less expensive. Ultrasound imaging can help detect lesions in dense breasts when interpretation with mammography is difficult. It has also shown to detect cancers that are mammographically occult, especially in patients with dense breasts. But like the example I showed you earlier, when the breast is very dense, you may not see the cancer.
Right.
So in that case, we can do ultrasound to supplement the findings. Sometimes we can detect cancers in dense
Not in
breast.
all
Yeah,
cases.
not in all. Complementing findings of other examinations like MRI or mammogram, ultrasound can also help further characterize a lesion that cannot be interpreted adequately by mammography alone, for example, fibroadenoma or cyst. So, simple images of some of the common lesions we see. This is a cyst, very well defined, no echoes inside, it's water inside. So, this is a cyst. And this one has got some tissue inside, but it is like an egg, very well defined. Yeah, this is a fibroadenoma. And here we see a lesion, no edges, very irregular margins. This is in fact cancer.
Yes.
Let's go further. Breast ultrasound elastography is another new imaging technique which provides information on breast lesions in addition to conventional ultrasound and mammography. So ultrasound elastography provides a non-invasive evaluation of the stiffness of a lesion. So malignant lesions, like they are harder than benign lesions, and this is the general characteristic that differentiates breast lesions. So a lot of them, like there are many breast lesions. Generally, benign lesions are soft lesions. Malignant lesions are hard. So sometimes when a lesion doesn't look like a cyst and it doesn't look like a typical fibroadenoma, so breast elastography can help us to decide what could be that lesion.
Right.
So in this example here, we have a lesion. It's not exactly an egg. Maybe margin is irregular. So here we would say, the radiologist might report this as indeterminate lesion. So once we do a breast elastography study, it is found that the lesion is actually quite hard. So it points more towards a malignant lesion.
Right. So this is amazing, non-invasive. So we have this in Assunta Hospital.
Yes.
Yes.
Glad to say that we do have a breast elastography study in Assunta. So, what are the limitations of ultrasound? There are several limitations that make breast ultrasound inappropriate for a screening test. These include ultrasound cannot take an image of the whole breast at once. So it uses a handheld transducer that is moved around to find an abnormality, and therefore it is very user dependent, particularly if the technician is inexperienced. Ultrasound also cannot image areas deep inside the breast, especially in some women with big breasts. So structures deep inside may not be imaged adequately by ultrasound. And ultrasound doesn't show microcalcifications. This is actually the main limitation of ultrasound in early breast detection. Many early breast cancers are first suspected based on microcalcification, which can be easily detected on mammogram, but not on ultrasound. So for a mass to be detected on ultrasound, the calcification would have to be significant. So in the end, neither mammogram nor ultrasound is perfect. We always advise patients to do both examinations in the same setting to increase cancer detection.
Right.
So, hey, breast cancer, we cannot 100% prevent you, but we sure can fight you 100%.
Yes.
So, just to give information on a breast screening subsidy by LPPKN, women who are citizens or permanent residents of Malaysia, aged 40 to 70 years old, with a household income of less than 10,000 are eligible for free mammogram screening test at a private medical center registered with LPPKN. Assunta is one of the center which However, if your household income exceeds 10,000 and you can still undergo a mammogram test with a 50 ringgit subsidy. Women aged 35 to 39 years old with family history of breast cancer before the age of 40 are also eligible for the subsidy through a doctor's referral.
Correct. Right. So thank you, Dr. Emily. Now, audience, ladies out there, this is a beautiful Pink October package that we have created for you. It is only 188. You have 3D mammogram and breast cancer marker. It is available till end of December. Please come forward, book with us, call health screening and book now. All right, Dr. Emily, thank you so much. That's so technical, but I'm sure all of us understand it better between 2Ds and 3Ds. I understand it better now. Now, I'm sure we have a lot of questions waiting, comments from audience. Let's have a look. Oh, we have all queued up here. Now, let's have a look at first question. Now, do I need a referral letter to do a mammogram?
If you are more than 40 years old, you do not need a referral letter.
Yes.
But however, between 35 to 40 years old, if you want to do a mammogram, you need to go see a doctor
Correct.
to see whether it's you are eligible. I mean, if you have any risk factors or not.
Right, right. It's quite clear cut.
Yeah.
Above 40,
No
you
need.
you don't need anyone's. Yeah. Right, let's take a second one here. We have, what is inflammatory breast cancer?
Inflammatory breast cancer is actually a form of breast cancer that
Mhm.
it presents with pain, almost like rashes, very uncommon, superficial cancer.
Mhm.
They don't present as lump. They
Okay.
present like rashes, eczema kind of thing.
Right.
That don't go away with treatment. So
Right.
in that case, we have to suspect inflammatory breast cancer.
Yes, yes. Thank you, Rachel, for writing it. Now let's take a look at the next one.
No question.
No question there. Let's see. Oh, can't see anything here. Alright. No, no question. I'm gonna take another one now. Now, when should I begin screening for breast cancer?
I think you are expert already. You begin
Yes.
screening after the age of 40.
Yes,
But
yes.
if you think you have high risk factors, you should go see a doctor to get a referral letter or whether you are eligible for mammogram or not
Mhm, mhm.
after 40.